Yeah, smoking is actually one of the best ways to move something through your entire body, inhaling something. So to say that it just would affect your lungs is being incredibly naive. Smoking affects many organs in your body.
Right. So that's you know, one thing we think about. But let's get back to the Gardasil, the vaccine. So you know, we know that with other diseases that we vaccinate, for example, polio, measles, etc., children are given immunizations, and it's to protect them through their lifetime, and we want to vaccinate them before they're exposed to the disease so that their body can generate the antibodies that they need so that if the disease, if they're exposed to the disease, they can fight off the disease and not get sick. And so that's the premise with needing to vaccinate young children. And so you know, some of the comments that we hear about people being, you know, so irate about this virus is that they link the immunization of children with this as being a green light for girls to be promiscuous.
Well, it implies to many parents sexual activity.
And that is not the goal of this. That is absolutely not the goal of this, you know, and as a mother, you know, I know I've taken my children, my 3 children, to get vaccines, and you don't have to tell your children you are now getting a vaccine, you know, to prevent meningococcal pneumonia or meningitis, which is, I just had to vaccinate my college child.
That means nothing to children.
They don't understand. So, you know, we rarely, if you ever think of when you take your child to get the measles, the mumps, the rubella vaccine, you're not telling them why they're getting vaccinated. All they know is they're getting a painful shot from the doctor, and they don't want that.
Not to mention, as you said, someone can be monogamous, can get married, never have sex with anyone but the person they're married to. But the person they're married to might have had sex with someone, and therefore they might be susceptible to getting HPV.
Right. You know, if we had a shot that would prevent breast cancer, there would not be a supply enough in this country alone for women to get that. And here we have something that can prevent a disease that can strike young women. I know of women who have had invasive cervical cancer. The 2 women I know most who have had it were not promiscuous women, which a lot of people, that's the other myth about cervical cancer, is they think only promiscuous women get it. That is not true. That is not true, and I get irate when I hear people say it's because that person was promiscuous. That is not true. These women are fine, upstanding women, and they were, you know, cut down in the prime of their life. One just after she had her first child, had a complete radical hysterectomy, no more children. And something as simple as these series of shots could have prevented that heartbreak and life for the rest, you know, for the rest of their life. It's just amazing, you know, how it could help, and I have a problem understanding when people understand what it's to do that they are still against it.
Let me ask you why we don't focus more on little boys as well, because if men are the carriers, and the point of vaccines is to immunize as many people as possible. You want to get as many people in the population immunized as possible. Why are we only pitching this vaccine for little girls?
Right now, the vaccine is only approved and demonstrated to work in girls, in women, in girls.
Well, my understanding is though Merck has tested this on boys as well.
And there's continued testing. So they're still working on it.
So it very well might be.
That's right. In a few years it might move to boys. But right now we're only FDA approved for girls.
I see.
And now the shot is a series of 3 shots. Okay. And you know, we are working to try to get legislature passed so that, you know, all carriers will cover the cost of the administration of the vaccine and things like that. So that's coming down the road in terms of cost, because there is some cost burden with getting the vaccine. You mentioned some states are requiring it.
Are beginning to require it, just like they do a whole list of other vaccines.
That's
in order
correct.
to go to school in a
That's correct.
certain year, you have to prove that you've gotten this vaccination.
That's correct. That's correct. But again, it's like what you said, and an epidemiologic term is herd immunity. So we're trying to get...
And herd immunity means to get the herd, essentially get as many people in the population vaccinated, because that way the people who maybe the vaccination didn't take are protected because the whole herd is protected.
That's exactly
and other
right.
people don't have it, so even if the vaccine didn't take in someone, they're protected.
That's right. So that's how we've eradicated smallpox, polio, measles. You know, we could go down the list of rubella, pertussis, you know, all of those by vaccination. So I think it's something, and we are going to be starting to do some research in the Appalachia area of Ohio to see what people know and what they think about both HPV and the vaccine. So we're really looking forward to that, because we really want to hear what people know and what they think about it, so that we can direct some education efforts towards that.
Now let me ask you one question. You mentioned that little boys are unaffected, men are unaffected by HPV. Doesn't it cause penile cancer in a very slim
Very
minority?
slim, but it's not anything, you know, that is
Epidemiologically significant.
right, like of epidemic proportions.
Not like cervical cancer.
Right, that's correct.
And what percentage of women in the U.S. Actually, the percentage is much lower than it used to be because of Pap tests, isn't it?
That's correct. In the 1940s, the rates of cervical cancer started declining, not only in the United States, but in other, you know, developed countries across the world.
Because detection became
Detection, and because of the use of hysterectomies. Because if you have a hysterectomy, usually they'll remove the cervix. So when you remove the cervix, that puts you at lower risk.
And we should say, hysterectomy, people might not know completely. Hysterectomy is the removal of the uterus and always the cervix as well?
No, not always, and not always the ovaries. So the hysterectomy can be with or without the removal of the ovaries, with or without the removal of the cervix, or, you know, leaving the bottom part of the cervix sometimes.
So because hysterectomies were done so much in older women, that also began to make, that was another reason that the rate of cervical cancer began to go way down.
That's correct, but really the Pap smear, utilization of the Pap smear is really touted as the #1 reason. And across the world, if you looked at countries where they systematically introduced Pap smear screening. Now, in a lot of other countries, they have socialized medicine. So they know every single woman who lives in a certain town. And so they would send letters to the women and invite them to come in for cervical screening.
And they make sure, and when you have a
comes.
national health care system, you make sure people come in for treatment.
You know who came, you know the results, and you follow up if there's a problem. In every one of those countries where they've had those programs systematically introduced Pap smear screening, they've seen significant declines in cervical cancer, significant declines. And so to us, that tells us it's Pap smear.
Really interesting. I want to thank our guest, Dr. Electra Paskett, for upcoming episodes, viewer feedback, and links to important information on health. Log on to our website at the address that appears on your screen. Thank you for joining us on Health Vision, a production of the WOUB Center for Public Media.